and welcome to our Monday Minute. Today we're going to discuss a hot topic in home health that we haven't addressed recently, and that is home health medical review. Home health medical review has escalated yet again, not near the escalation that we see in hospice, but is still becoming overwhelming for some home health agencies. It's imperative that you understand the type of review that you're involved in and ensure that you are fully equipped to respond to those reviews. Targeted Probe and Educate is the number one audits that home health agencies are seeing in the Medicare MACs. The Medicare MACs are issuing a letter explaining that this audit is going to include between 20 and 40 claims, calculating a denial percentage after each level of review. And if you exceed the acceptable denial percentage, you will continue to the next round. The most important part of going to the next round is understanding that once you have had the education call with your Medicare MAC, they have to wait 45 calendar days before they begin the next level of review, giving you time to make changes, edits, etc. to your charting to ensure that you don't have denials for the same reasons you did in the previous round. The other levels of medical review include UPIC audits, SMRC audits, the CERT review that most agencies go through every year or so, that's only 1 or 2 charts. And then the RAC audits, or Recovery Audit Contractor audits, that have come back to the forefront of home health and hospice since the end of the public health emergency. The recovery audits are conducted by one single audit company, and that is Performant. They are only pulling 1 or 2 charts at a time. You do need to respond to them exactly the way you would respond to any other audit. We have also seen some surge in the OIG audits, where charts are sent directly to the OIG for medical review and responded to, and appeals are sent back to the OIG for review instead of the normal appeals process. Regardless of the level of review that you may find yourself in, you need to be fully cooperative. You need to be timely in your response to them. And most importantly, if you have denials, you need to ensure that you appeal them timely. In situations where you are hit with a UPIC or a SMRC audit, extrapolation may be involved, which means they take your denial percentage and extrapolate that over the universe of time that the audit encompassed, causing $200,000 to turn into $2 million if volume were to apply to that. And so the appeal process being filed timely can stop them from beginning the recoupment until the appeals process has been finished. The ALJ is pretty much the highest level of review that home health agencies might take their appeals to. We always encourage you to never give up. The only appeals that we would tell you to not do are ones where you have been denied solely for something that cannot be corrected. Some people believe that a signed order without a dated signature is automatically a death sentence, and that is not necessarily the case. We have seen appeals overturned when the physician signed an attestation as to the date of his original signature. That is not always a win, but we have seen that happen. Also know that anytime you receive a denial where the denial is subjective, such as lack of documentation to support medical necessity, and those types of denials, you will have the opportunity to allow the clinician or physician to send attestations with additional documentation. You may have left out testing or laboratory results that might assist you with medical necessity, you need to pull out all the stops. But you do not need to give up. We have won numerous ALJ hearings just recently where it was simply a matter of laying out the very detailed, specific information for the ALJ that caused them to overturn the denial decision. Paying attention to any audits that you receive, immediately responding, becoming engaged with the reviewers on the other end, and ensuring that they understand your full cooperation is being had is very, very, very important. You do need to make sure that when you are compiling those charts, that you have someone clinically review those charts to ensure that everything that would be looked at from a clinical standpoint is in the chart, that you have appropriately included a table of contents, paginated that document, and included a cover letter that basically guides the reviewer through the chart. We are here to assist at Healthcare Provider Solutions in any way you might deem necessary when engaged in medical review. Please don't hesitate to reach out if assistance is needed. We hope you have a fabulous week, a happy Easter, and welcome to spring.